Well, diabetes is growing quickly for a number of reasons. Number one is our sedentary lifestyle that we have. For example, how many kids walk to school anymore? Every kid takes a bus. There's been implications of other things like high fructose corn syrup, things like that. But I think a lot of it has to do with our poor dietary habits, lack of exercise, and then there's a dose of genetics in there too. So when you look at all these factors, this is what is causing the worldwide epidemic of diabetes, which my father had. My mother developed at the end. My sister has, my uncle, my grandfather, which is why I'm trying to lose another 20 pounds.
All right, let's do, we still rolling? Okay. Let's do, how important is the doctor-patient relationship?
Well, the doctor-patient relationship is one of the most important things. Obviously, that has eroded over the years, with the advent of HMOs and the interruption that has occurred in healthcare. For example, we've had situations where we prescribe a medication and the insurance company says no. And one thing that really upsets doctors, they refer to us as healthcare provider, not as your physician, but as your healthcare provider, and you as a consumer. We were trained, it's the doctor and the patient, not the healthcare provider and the consumee. It's really set up a bad situation.
And how do you reverse that in your current practice?
Well, I think we get back to basics. We're back to the old way of practicing. The patient calls, they have a problem, and they're seen. We sit down, we find out what their history is, what their likes are. Even one thing that I didn't do since I was a medical student was home visits. My father, who was a physician, made home visits. My father-in-law was a primary care physician, made house calls. But we were even taught that you go to where the patient lives, you go into that environment, you see their house, how they live. It really tells a lot about a patient.
And how can that help you with knowing more about the patient to be a better doctor?
For example, you get to see how they live, what their situation is, their mobility. If are they able to get upstairs? Can they get downstairs? Can they get to the bathroom? Do they have the right place to sleep? That's basically how it helps.